Good morning. On behalf of Patient Choice in Chemin, Neuf, Pointe, Michel, I'm Dr. Dangleben with your daily medical tidbit. I do want to say that our Patient Choice Facebook page was hacked and literally taken over. But we're working on that. But Patient Choice is there in Pointe Michel. Go out and support what we're doing. I want to continue talking about electrolytes, and yesterday I talked about phosphate. The day before that, potassium. Today I want to talk about magnesium. Magnesium is a essential mineral, right, for our health and our life, right. It is involved in many of the what we call enzymatic reactions, the reactions that need to take place in our body. Right, for example, in energy production, muscle function, nerve transmission, bone health, right? But we never talk about magnesium the way we talk about calcium and the other electrolytes, right? So understanding its function, the dietary sources, the health benefits, and the consequences if there's any deficiency is essential. We need to, as we continue to educate ourselves, we need to talk about these things, right? So it's required in a lot of processes in our physiology. It's actually a cofactor for enzyme involved in DNA replication. So for DNA to replicate itself, right, or RNA to transcribe itself, transcription, and protein synthesis, magnesium lies within that, okay? It stabilizes ATP, which is what I talked about yesterday, the phosphate. So it goes hand in hand with that to produce energy, right? So that is very, very important to know about magnesium. In the nervous system, it regulates the neurotransmitter, the things that carry information across the nerves, right? So that's important for brain function, your mood stability, and all these things. Okay, muscle contraction and relaxation. It works by regulating calcium within your muscle cell, right? So when you're getting cramps and you're having all these muscle issues, I usually say it's either potassium, magnesium, or calcium, right? So just something to know, right? So it can lead to cramps and spasm. Just remember that, all right? And cardiovascular health, the health of your heart is important. It maintains the heart with other electrolytes, and by supporting the vascular tone, the tones of the blood vessels. All right. What are some of the dietary sources and what's needed? Okay. It's widely available. So if you're eating right and you focus on your diet, there should not be an issue with the amount of magnesium that you take, right? So we're talking about the daily, what's it called, the RDA, the recommended dietary allowance, the RDA, is about 400 milligrams per day for an adult, right? So things that are rich in magnesium: leafy greens, your spinach, your kale, Swiss chard, right? Lots of nuts and seeds, the almonds, your cashew, pumpkin seeds, sunflower seeds, right? The whole grains are important. We talk about brown rice, oats, right? Black beans, chickpeas, lentils, all right? Your seafoods, salmon, mackerel, sardines, right? And dark chocolate. And I think that's where the cocoa comes in Dominica in terms of what we eat. Dark chocolate is very high in magnesium. Remember that. All right? So magnesium is abundant in plant-based foods. So when you refine those foods, when you have all this processing of these foods, you're stripping all these good minerals away. Right? And that's important to know. So if you're going to do your plant-based, try to do it more on the raw side. Listen to Brother Zed. Okay? So, for example, polished white rice, right? They've stripped the magnesium away, right? Your white bread stripped the magnesium away. All right, so remember these things, all right? So magnesium is an overlooked electrolyte that's important for your bone health, right? The mineralization of the bone to make your bone strong. It interacts with calcium and vitamin D, and it reduces your risk of osteoporosis, all right? Studies have shown that magnesium regulates the blood pressure and lower the risk of high blood pressure and heart disease. It actually improves insulin sensitivity and plays a role in blood sugar regulation. It lowers the risk of type 2 diabetes. Magnesium has been linked to symptoms of depression and anxiety, and they think it has to do with regulation of neurotransmitters like serotonin. Okay, so just something to be cognizant of, right? If you're deficient in magnesium, there's several forms out there, right? Again, you shouldn't be, really. I'm being honest, because unless you're taking only processed foods, then you're at risk. But deficiency, muscle cramping, tremors, spasm, right? Extreme fatigue and weakness, right? Anxiety, palpitations, all these things can be related to magnesium deficiency, all right? And if this becomes a chronic issue, you're going to have a lot of problems. And one of the big risk factors that impairs the absorption of magnesium is excessive alcohol consumption, uncontrolled diabetes, and certain medications, right? Especially things like omeprazole, the pantoprazole, which is the proton pump inhibitors, which I have talked about before. There are many types of magnesium. It's just what they bind to in terms of the supplements, right? So you'll go there to the shelf and you'll see magnesium citrate. You'll see magnesium oxide. You will see magnesium glycinate and all these other forms, right? But it's the magnesium part of it that you need, all right? Talk to your doctor. Let them know that you're taking this, all right? And that should be guided by your healthcare professional. All right. So I want to end by saying that recognize that magnesium plays a very, very essential role in our health. All right. And you can get it through a balanced diet, right? Less processed foods, right? Plant-based, either parboiled or raw, is better, especially the greens, right? And it's considered the silent mineral, overshadowed, just the same way I talked about phosphate. All right, so just remember that as you go through your re-education on magnesium and your health. All right, and just talk to your docs, and docs talk to your patients. It's important. All right, and when you go to the store and you're looking at the labels, ask the questions. All right, because the magnesium oxide versus the magnesium sulfate, right, which is Epsom salt, by the way, right, has all the different there's certain side effects that you can get from one from the other, just by, not from the magnesium itself, but from the entire molecule. So you might have diarrhea, you might have some GI issues and things like that. So just read the labels, talk to your doctor, and go from there. But focus on your general health, right? Not just physical, but mental. And a lot of these electrolytes can affect that. I'm Dr. Dangleben. Have a great day. Peace.